My name is Amy Taub, dermatologist in the suburbs of Chicago, and I joined Forefront in November of 2023. The most important thing was that we had the same value system. I've always had patient care as my North Star, and I didn't want to join any organization that didn't also feel that that was their top priority. So my hesitations during the process of joining were, of course, the same fears that most people would have when going through a process like this. Honestly, having owned my own practice for over 20 years, and it was very emotional. And at each time when we came up upon a kind of a conflict point, all the leadership team at Forefront came together and met with me, or even them, tried to work through some of the kinks and came to what I thought was a reasonable settlement. And I was very pleased that they seemed to be quite flexible and also understanding of how important these issues were to us. How has Forefront changed my day-to-day experience with my patients? Pretty much not at all. Everything runs exactly the same as it did before. Sure, there's some differences, like we're using a different computer or screen or a different iPad or whatever that is. We send our path to Forefront, which I have to say is completely exceeded my expectations. And so really, I have to say there has been almost zero disruption. The main way that joining Forefront has impacted my life has been in the relief of anxiety over the ability to continue to shepherd forward such a large practice, have it continue to grow, and worry about the outside elements that we can't control, for instance, the economy. It's not like those things wouldn't impact me now, but I feel like I'm in a better position. And I tell people, instead of running the practice, I now direct it or I oversee it, which is a step back. I still am totally involved in the management process by choice because I really enjoy working with the people I've worked with for so many years. But it just feels less burdensome. So being part of a group like Forefront is exciting because sometimes it's a little lonely on the top. So you get to meet all these other practice owners and also non-practice owners. But it's like a camaraderie, a group of dermatologists who really are pretty like-minded. And so it's kind of like a microcosm of, say, going to a meeting where you see some of your old buddies, but instead they actually have similar goals to you and you can kind of reach out to them anytime. Not that you couldn't reach out to others anytime, but it just feels a little more collegial, and I feel like I've made some new friends and it's been very nice.